Good afternoon. We are back with Pulse 22 and I am Savith Wijesuriya from the Interact Club of Kingswood College, Kandy. And today we are here with Dr. Sayuri Perera and we are going to talk about something really problematic in the current society: addiction. Addiction can be seen as a major problem, especially in the younger generation. There are different types of addictions and some limit between addiction and normal usage can be a little bit unclear, doctor. So to start off, what exactly is an addiction and what are the most prominent addictions in the world right now?
Yeah, that's a really good question, Savith. Actually, addiction is simply defined as doing something or taking something despite knowing that it is harmful for you. So that is what addiction is. And there are various types of addiction. So I said you can do something that is engaged in a certain type of behavior, or you can take something like a substance perhaps, despite knowing that it is not good for your health. Yes?
So doctor, now there might be a question of whether everything falls under the name of addiction, even good things. Can we clarify this a bit? Talk a bit about what falls under addiction.
Yeah. So as I mentioned before, there are behaviors and there are substances that you can get addicted to. So if you talk about behaviors, even things like unhealthy eating or gambling, these kind of behaviors, or taking substances like alcohol or any other strong drugs that we talk about, cocaine and nicotine, alcohol. So the list is pretty long. So taking these or engaging in negative behaviors that I mentioned fall under the category of addiction. Now, in order to categorize somebody as being addicted to a particular behavior or a particular substance, one should meet certain criteria. I'll mention a few. If you continue to take this substance or you continue to engage in this behavior despite knowing that it is bad for you, and if you have to, so if you focus on a substance perhaps, let's focus on say alcohol for an example. If you find that you need to take more and more and more of this substance, if you have difficulty controlling your use of this substance, and if it comes to a point where you are neglecting alternative pleasures in your life in favor of using this substance, then you may fall under the category of being addicted to this particular substance.
Unfortunately, we see addiction as a common problem within the children of our age, youth probably. Why is it that teenagers and youth often fall prey to this compared addiction to other ages?
Yeah, that's an excellent question and I'll explain why that is so. If you look at adults who have problems with addiction, 75% of those problems have started during their teenage years. There's a reason for that. See, the teenage brain matures until the age of about 18, 19. And the brain of a teenager is immature in certain areas, particularly what we call as the frontal lobe. The frontal part of your brain, for example, is less developed than the frontal part of my brain. And the frontal part of your brain is known as the CEO of your brain. It's the part of your brain that makes decisions as to whether something is good or whether something is bad, whether something is safe or unsafe, right? So it makes important decisions in your life. Now, the teenage brain has difficulty in recognizing what is safe and unsafe, unlike the brain of a mature adult. So the moment a teenager or a youth, like you mentioned, engages in something pleasurable, like taking alcohol or gambling or gaming, the brain of a teenager finds it difficult, like I said, to recognize this as a bad thing with bad consequences. So it's difficult for a teenager to put brakes on this particular behavior, whereas an adult will recognize, oh, this gambling is bad for me, this use of alcohol is bad for me, I need to stop this behavior and move on to something healthier. Okay? So the teenage brain is a bit like a car without brakes. You just keep on going, as long as it's pleasurable, you just keep on doing it. So that is why the teenage brain is more likely to become a victim of addiction than a mature adult.
So thank you very much, Dr. Sayuri Perera, for being with us today. We shared a lot about addiction, and I hope to see you again in a program just like this. Thank you very much.
Thank you very much for having me. It was an absolute pleasure being here today, and I hope that we can do some work together in the future as well. Thank you.